Gynecomastia, man boobs. Let's talk about it. What's up everyone, Boob here, and it's been a while. In my earlier videos, I promised you that we were going to talk about prosthetics, healthcare, and everything in between. And this video is something that's definitely in between and somewhat personal. I want to talk to you about gynecomastia and what to expect. Now, what is gynecomastia? Gynecomastia is actually defined as swelling or enlargement of the tissue in the male breast, aka man boobs. But contrary to a lot of these videos you see online, YouTube, Google, you can't just work this out. You can't go and do the push-ups, you can't go and lift weights to actually get rid of them. Yes, you can define a lot more muscles underneath your chest, but ultimately in the end, you may need to get surgical intervention to get rid of the excess tissue. So workout is not going to resolve it, surgery is. Now just to update you, I was diagnosed with gynecomastia as a teenager. I've been overweight most of my life, and there are other family morbidities that I was concerned about. Once I got into the field of healthcare though, I learned just how important health is and decided to do something about it. I worked out, I ate clean, I lost weight, started to feel really good, but unfortunately, just because of my diagnosis and the excess skin I had to explore some surgical intervention. When I Googled this surgery, I was very discouraged to find that there weren't a lot of examples of this type of procedure for someone who looks like me, someone of color. And if I did find an example, it was of someone that didn't even match my body type. So with this, I would like to share my experience with you. As you can see, I just recently had the surgery, and I'm going to share exactly what I experienced. Now, as a disclaimer, only use this video for informative purposes and to give you some feedback. It is very important that you actually speak to a doctor and a medical professional before you proceed with anything that I'm about to inform you today. And with that, I hope that by sharing this with you, I can give you an example of what to expect, as well as keep you updated with my progress. What I did is I went out, found and interviewed a good plastic surgeon. Now, anytime you're interviewing a surgeon, you want to ask specific questions about the procedure and things that are related to your goals. What I asked, pain management. What can I expect? How long will my recovery be? But some of the things that was very important to me also included things like, how many people of color have you done surgery on? What were their outcomes? Also, what were the outcomes of their scarring? What can I expect with my skin type and skin tone? What can I do to minimize this kind of scarring? Things like that affects me and also may affect some of you watching this video. Because one of the things I mentioned earlier in this video was there's just not a lot of examples online of someone like me who have this kind of surgery. So I want to make sure I'm sharing that with you and make sure that you're asking the right questions. After my vetting, I chose the best doctor that was for me. And I felt pretty good about it. So after I did that, I paid the doctor in advance, paid the anesthesiologist. Most of you may not know this, but you do have to pay separately to the doctor and an anesthesiologist. And I booked my date. Now, after I booked my date, during my pre-op, they did prescribe me some medications. So they did give me gabapentin, Zofran, forgive me if I'm mispronouncing that, Celebrex, oxycodone, and also Tylenol. All of these were going to help me prepare for my surgery. And 10 to 14 days before my surgery date, I had to stop all aspirin, ibuprofen, Advil, painkiller, things of that nature, because all of this may conflict with my medication and also cause some bleeding complications that I definitely wanted to avoid. Now, within 2 days of my surgery, I had to follow these instructions. Once again, your instructions may be different, but this is what I had to experience. 2 days before my surgery, I had to shower with Hibiclens. That is a body disinfectant that allowed to clean the surgical sites right before my surgery. 1 day before the surgery, I not only had to shower with Hibiclens, but I also had to start taking my medication, the gabapentin. And then the day of my surgery, which was really early in the morning, my surgery was booked at 7 a.m. So around 6 o'clock in the morning, I had to take not only my medication, I also showered with Hibiclens to prepare my body for the surgery. Now, upon my arrival at the facility, I felt very comfortable going in. I was nervous at first, but once I entered there, the nurse helped me out. She made me very comfortable. She answered all of my questions. She gave me a gown to change in as I was waiting in the examination room for the anesthesiologist and for my doctor to come in to explain the surgery. Now, the anesthesiologist came in to ask me questions about my pain history to kind of get a good idea of pain I was experiencing at the moment, maybe previous pain, so that way they can make sure that I'm very comfortable during my surgery and they can make any adjustments. After the anesthesiologist left, then my doctor came in. He went over the details of the surgery. He made drawings all over my body to kind of show me exactly where he was going to perform surgery and how it was going to work out. And then after that, I was escorted right into the examination room. Now, here I am, I'm in the operation room and I'm waiting for my procedure. At this time, the nursing staff is still talking to me. They're making me very comfortable, and my anesthesiologist is putting an IV into my arm. Now, for those of you who have never been under anesthesia, which I have never been, I was very nervous about this experience. I was nervous if I was going to feel it, if I was going to feel myself falling asleep, or just what to expect at that point in time. And to be honest with you, I still don't remember what happened because that's how good it was. To be honest with you, I remember them asking me a question about what I do as a career. And once I gave them that answer, the next thing I remembered is my leg being tapped. I'm sitting up in a chair and they're informing me that my wife is here to pick me up. So that was probably one of the best experiences because I just don't remember exactly falling asleep, and there was absolutely nothing to fear at that point in time. So I got home. I felt relaxed because the drugs were still kicking in, and I was able to eat and just stay hydrated. I was very fortunate that I didn't feel nauseous after the surgery. I know I was provided some medications for it, but I didn't actually need it. So for me, I just was able to drink some water, I drank some ginger ale, and I had some soup before I went to bed, and I felt very, very comfortable. The only thing I was thinking about was that after surgery, they advised me that I couldn't shower or do anything for 48 hours. So I'm looking forward to my first shower for sure. But in the meantime, I'm just going to take it easy. This whole recovery, I was informed by my doctor, is going to take approximately 6 weeks. Now, that's for a full recovery. I plan on doing a follow-up post-op appointment in about a week just to see how I'm doing and see how well this vest is doing, and of course look at my surgical sites. But overall, I'm feeling pretty good. I don't have any tubing coming out. They were able to do the surgery and minimize any kind of swelling as best as they can. The most I can probably share with you right now is to kind of show you that there was a little bit of oozing right here on the side, but outside of that, I'm still pretty comfortable. So I will kind of keep you guys updated as I go and see how the rest of this experience turns out. So if you found this video very helpful to you or informative, please be sure to hit that like button. Also hit that subscribe button at the very bottom. I plan on sharing more and more information as this goes along, so that way you can kind of understand my experience with the surgery. And if you are someone who is looking into the surgery, or possibly you have family or friends who are looking into it, you can share this information with them and hopefully gives them a little bit of information moving forward. But if you did like this video and you want to leave a comment below, or maybe if there's a question that I can answer for you, please leave a comment below and I'll do my best to answer it below as well as include it in my next video. But in the meantime, thank you so much for watching, and I'll see you guys again in the future.